Hi, I am Myla Joyce Cantoa, a first-year nursing student at Central Mindanao University, and today I am not going to demonstrate any procedure. Instead, I am going to talk about a procedure, and that is called removing drugs from ampule and adding to intravenous fluid containers as piggyback. So before that, we're going to do an assessment, which is to assess the ampule for any cracks and chips, and to assess the medication in the ampule for any particles or discoloration. And for the possible nursing diagnosis, we have risk for infection and deficient knowledge. For the materials, we're going to be needing sterile syringe, a filler needle, a small gauge or pad, and an ampule. Since we're all set, we're going to talk about now about the procedure. For procedure number 1, you need to verify the practitioner's order, review an accurate list of all of the patient's medication and supplements and allergies. This helps to identify errors that may have occurred when orders were being transcribed. For the procedure number 2, you need to know the actions, the adverse effects, side effects, and nursing responsibilities related to the drug that you're going to give to the patient. This aids in evaluating a therapeutic effect of the medication in relation to the patient. And the next thing you need to do is to wash your hands or apply alcohol-based hand rub. This is to prevent contamination or the spread of microorganisms. And for the next step is to prepare or gather the supplies and check medication or the IVF solution to be used. This is to save our time and to use our energy efficiently. And now for the procedure number 5, compare doctor's orders with the medication ticket and the medication ticket with the medication. This is to ensure that the right patient receives the right medication. And we are now going to proceed to the next step, which is to check the expiration date of the medication that you're going to give to the patient. This is to ensure the safety of your client. For the procedure number 7 is to perform the standing 3 checks of the drug together with the medication ticket. The first thing is when it is taken from the medication cart. The next thing is before withdrawing the medication and after withdrawing the medication. This is to check the medication before administering it. And for procedure number 8, tap the stem of the ampule while holding the ampule vertically. This facilitates movement of the medication in the stem to the body of the ampule. For procedure number 9, wrap a small gauge pad around the neck of the ampule. This will protect your fingers from any shattered glasses fragments. For procedure number 10, you need to break off the top of the ampule along the scored line as its neck always break away from your body. This protects your face or fingers from any shattered glass fragments. For procedure number 11, you need to invert the ampule and withdraw the calculated amount plus a small amount more, approximately 30% more. And by withdrawing a small amount of medications, any air bubble in the syringe can be displayed. So for procedure number 12, you need to expel the air carefully by pushing on the plunger to make sure that the medication is in proper amount and no air bubbles is present. For procedure number 13, discard the ampule in a suitable container. This is to avoid contamination. For procedure number 14, you need to get the prescribed IV solution, open it, and disinfect the injection port. This is to avoid contamination of the needle and the medication. For procedure number 15, you need to inject the medication from the syringe to the injection port to instill the medication. For procedure number 16, you need to mix the medication solution by gently rotating the IVF bottle. This is to ensure that the medication spreads around the IVF bottle. And for the next step, attach a label or upside down on the bottle with the name of the drugs added, the date, time, and the nurse initial to help the next attending nurse on duty and to raise awareness. For procedure number 18, you need to clamp the IV tubing, spike the bulb at the bottle with the IV tubing, and hang on the IVF pole. This prevents fluid from entering the system until the nurse maintains sterility. So for procedure number 19, you need to open the roller clamp and remove the air from the tubing. Close the roller clamp, prevents backflow, opening flow of primary solution. For the next step, you need to attach needles to the connector and cover it with a needle cap. This is to continue the transport of the IVF. For procedure number 21, transport the solution to the patient's bedside carefully. This saves time and uses our energy efficiently. For procedure number 22, you need to perform hand hygiene and don a glove. This prevents contamination and the spread of microorganisms. For procedure number 23, you need to identify the patient by asking the patient to state his or her complete name, birth date, and ask if he or she have allergies, and to check the identification bracelet in her or his wrist. And for the next one would be if the patient can't identify himself or herself, verify with a staff member who knows that patient. This is to give the right patient to the right medication and to avoid errors in administering the medications. For procedure number 24, complete assessments before giving this and to check also for any allergies that the patient have. This is to ensure the safety of the patient. And the next step would be is to explain the purpose and action of each medication. This is to educate the patient and to give awareness. For procedure number 26, you need to disinfect with alcohol the white port of the existing IVF solution to avoid any contamination. And for the next step, insert the needle of the IVF infusion set to the white port and regulate the flow rate as ordered. This is to ensure that the medication is properly administered. And for procedure number 28, you need to do an aftercare, remove your gloves and other equipment that you use. This is to prevent contamination and maintain cleanliness. And for procedure number 29, you need to evaluate the patient and document the procedure. This is to monitor for any progress on the condition of the patient. And that's it for today. Thank you for listening with me and thank you.